By the way, I'm zooming into Mr. Smooth's classroom. No break. Just going straight to Mr. Smooth's classroom. Last week, we spoke about masturbation addiction. And I spoke about how you can deal with the addiction. And for those of you who missed that class, it is on YouTube. Papa Kwamina, Mr. Smooth. I did a very wonderful video. The quality is not that good because I used my laptop. So you can watch it and learn how you can deal with your addiction. But for today, I am doing something that normally people will not want people to talk about, but I would. Because if you're educating people, it is important that you have those people that you're educating at heart. Now, I am asking this question. Is aborting an unborn baby murder? That is what I want you to see. Is aborting an unborn baby murder? But before we get into the class itself, I want you to see how the sperm travels from the man and then meets the egg, fertilizes it, and gradually we see when you miss your menses what happens, what the baby looks like, and then stage by stage we'll look at it, and then we will do what the doctors do. Find how the doctors abort the babies and how the babies are like when they are aborted, and then we get to ask ourselves whether what we are doing is murder or it is just freeing ourselves from a man who doesn't really love us. So you can stay with me, watch this video. So here you can see the sperm leaving the man, running all the way through the uterus and then to the fallopian tubes, and then trying to find the egg to fertilize. So you can see millions of sperm trying to find a way to penetrate into the egg, and then fortunately one gets in there, it pushes its head inside, bingo, fertilization takes place, and then all the other millions of sperm will be hanging outside. They've been locked and all of them die. And then when it finds itself inside, then it breaks the tail off and then attaches itself to the woman's egg. Right at that point, life begins. Now, this zygote will roll all the way from the fallopian tube all the way down into the uterus. And it takes a number of days, and then when it gets there, it will attach itself to the uterus that you call the womb, and that is when the baby that you already have, the life begins. So actually life begins the very time that the sperm of the man meets the egg. That is when life begins. So just look at this wonderful things that happen in the womb of a woman. And this is the beginning of life. This is the beginning of every human being's life. We all went through this. So by the time you miss your menses, this is the way the baby in your stomach is looking like. After this video, I'm going to show you a couple of pictures that will make it a little more clearer to you, so you know exactly what you're doing. So you can see the baby's heart beating, and it beats a little faster. Yeah. Alright, so this goes on and on and on till the baby is born. And I tell you, from the very time you miss your menses, you are already 2 weeks pregnant. So if you have sex and you get pregnant, or you have sex and the man releases sperm into your private area, this is how it looks like. And then once the one sperm is able to fertilize the egg, immediately you miss your menses. The very moment you miss your menses that you are pregnant, that is the size of the baby you have in your womb. You can see it there. That's the size of the baby you have in your womb. Now you need to understand this. Yes, we all say that pregnancy takes 40 weeks, but in actual facts, it is 38 weeks. Because the first 2 weeks, you are not pregnant. It is after you ovulate, or after you ovulate and then the egg of the sperm meets the egg, that pregnancy takes place. So even though it is said it is 40 weeks, it is actually 38 weeks. So a woman is actually said to be pregnant only when the egg of the sperm meets the egg. So it is in the second part of it that we call pregnancy. Now by the 4th week of pregnancy, you start feeling pregnant, and then the signs that makes you start feeling you are pregnant is that you feel bloated, you feel crampy, you feel tired, you feel moody, you experience some sore in the breast. Sometimes you feel nausea, or you start vomiting, and then you have some frequency. You feel like peeing quick. It's a sign that you are pregnant. And then note that all these things are normal when you get pregnant. They are very normal when you get pregnant. So this is a picture of your 1 week, your 2 weeks pregnancy, 3 weeks pregnancy, and 7 weeks pregnancy. This is the way the baby looks like. So if you are pregnant, you miss your menses and you are pregnant, and you do anything to take the baby out, this is what you have killed, or this is what you have taken out of your body. The heart is already there and the baby is already forming. So by the 5th week, you have the size of the embryo growing like the size of a grain. The heart is already pumping. And then some of the organs of the body, they start developing, and then the arms and the legs also start appearing. By the 6th week of pregnancy, now you, the woman carrying the pregnancy, you start having that worry. You start worrying about having a miscarriage, becoming afraid you're going to lose the baby and all that. By the 7th week, the embryo will double its size. And once the size doubles, just about a few inches, your hormones will start going up, and then you start feeling a little sickness, and then the morning sickness becomes worse. Basically, this shows that you are pregnant the first 7 weeks. Now let's see what happens. Now in this picture, you are seeing the pregnancy in the 8th week, in the 9th week, in the 10th week, and in the 11th week. And you can tell that in the 11th week, which is not even up to 2 months, the baby in your body can even suck the thumb. So it's anyway, by the 8th week, when a doctor looks at the baby, You can have the through an ultrasound. You can feel the baby's heartbeat, and then the doctor can give you an official date when you're going to deliver. And then by the 9th week, you start feeling that there's a little pressure on your bladder, because then your stomach is becoming a little bigger, and that leads to frequent urination, that you start leaking urine small. By the 10th week, the baby becomes about an inch long, and then your anxiety about having a healthy baby starts increasing. It starts increasing. By the 11th week, your cravings, and then that is when people eat all sorts of things. You even smell somebody's stew in his house, and you want some to eat, and then you go hanging around people's doors begging for food, and some even eat white sand. The guys call it ayolo, and the Fantis call it shure. You start having cravings for non-food, things that are not really healthy for you, but I mean, you have those cravings, and then by that time, all the organs of the body of the baby that you're carrying starts functioning properly. Now, when you terminate the baby from any point, any of these points, the question I'm asking here is, abortion, termination of pregnancy, is actually a decision. They are basically is a decision that you make. There are methods that are used in doing these things, and basically there are about 3 or 4 methods. Now there are a little more, but basically 3 or 4 methods. 1, you invade and kill the child with an instrument inside your uterus through your cervix. And then 2, you use drugs to kill the baby inside you. 3, they can have surgery and bring the baby out like a cesarean. And with these, they have several methods in between these 3 that we are going to be looking at in our class today. So here, if you get pregnant, immediately you miss your menses. This is the baby you have, and the baby is 2 weeks hitting towards 7 weeks. Between 2 and 7 weeks, if you terminate the baby, this is what you have removed from the body. And normally people use medicine. They go to the drugstore. There are some medicines that now has become very popular, very common in this country, not necessarily for aborting babies, but the side effect is for abortions, and people have taken to that tablet, and anytime they get pregnant, they just go and buy it. I will not mention the name. Yes, I will not mention the name. If you think I would, I won't mention the name. But you see, when that happens, this is the effect. You kill a baby like that in your stomach. Now, I have a doctor who will share his experience with you.
Obstetrician gynecologist, and I performed over 1,200 abortions. Today I'm going to describe a first trimester medical abortion. This is a procedure in which the mother swallows pills in order to terminate her baby, and it is performed up to the 10th week of pregnancy. The procedure involves 2 steps. Step 1. At the abortion clinic or doctor's office, the woman takes pills which contain mifepristone, also called RU46. RU46 blocks the action of a hormone called progesterone. Progesterone is naturally produced in the mother's body to stabilize the lining of the uterus. When RU46 blocks progesterone, the lining of the mother's uterus breaks down, cutting off blood and nourishment to the baby, who then dies inside the mother's womb. It is important to note that even after it has been taken, it is possible to reverse the effects of RU46 and save the baby if progesterone is administered. The sooner, the better. Step 2. 24 to 48 hours after taking RU46, the woman takes misoprostol, also called Cytotec, that is administered either orally or vaginally. RU46 and misoprostol together cause severe cramping, contractions, and often heavy bleeding to force the dead baby out of the woman's uterus. The process can be very intense and painful, and the bleeding and contractions can last from a few hours to several days. While she could lose her baby anytime and anywhere during this process, the woman will often sit on a toilet as she prepares to expel the child, which she will then flush. She may even see her dead baby within the pregnancy sac. At 9 weeks, for example, the baby will be almost an inch long, and if she looks carefully, she might be able to count the fingers and toes. After she has disposed of her baby, the woman may have bleeding and spotting for several weeks. Bleeding lasts, on average, 9 to 16 days. 8% of women bleed more than 30 days, and 1% require hospitalization because of heavy bleeding. The failure rate increases as the pregnancy progresses. If failure occurs, she will usually be offered a surgical abortion. For the mother, medical abortion often causes abdominal pain, nausea, vomiting, diarrhea, headache, and heavy bleeding. Maternal deaths have occurred, most frequently due to infection and undiagnosed ectopic pregnancy. As I mentioned at the beginning, I'm Dr. Anthony Levatino.
All right, so you heard Doctor talk about this one. Now, this is another method that is used. D and C, quite popular in this part of our world. And what is that? They use an instrument. They insert the instrument into the woman's private area, go all the way through the cervix, into the uterus, and then use a sharp knife, cut the baby into pieces, and then suck it out. So, this is what happens. When they are sucking the baby out of the womb, some would use some equipment, some use a pump, and those that use the vacuum pump is called a suction abortion. And I'm going to show you a video that has that exact way of doing it soon. Now, so by the 11th week, your baby is that big, and blood is circulating properly. The whole body part has been formed. You have the heart beating around 110 beats to 160 beats per second, and then you have the white blood cells functioning. Everything about the person, the bone marrow, the immune system, the lymph nodes, everything about the baby is okay. The baby has mouth. It starts crying, but only it is very silent. The baby is able to move the lips inside the woman's stomach. The brain has been fully formed, and then the child can feel, and it can even suck the thumb, and can even hear the mother's voice. And I tell you, by this time, you have a complete human being in your stomach. And this is how it looks like. This is how it looks like. And this is what people do. Now, by between the 6th and 14th week, when you're going to take away a baby like this, you have to apply general anesthesia, so that you inject the woman, and then you have to use some equipment to dilate the cervix, to open the cervix up, so the cervix will become open, and then you continue trying to open wide enough so you can have access to put the knife inside to be able to cut the baby. And sometimes there's a scissors. I'll show you a video that has that in there, cutting the baby and bringing the baby out, sucking the baby out. So when you see these things, you should know. Now, it's important to understand that the instrument that is connected to the vacuum pump actually sucks and tears the baby. At a certain age, week, you don't necessarily have to cut it. When it's not that old, when the body is not that strong, the pump can suck the baby out and tear the baby into pieces. But when the baby grows a little, then they'll use the scissors to cut the baby into smaller pieces and suck it out. And in times like this, the woman may bleed between 3 to 14 days, and some may experience some moderate cramps, and some simply take some painkillers and get over their pain. So this is generally how the suction is done. Let's watch this video and see how it's done properly.
My name is Dr. Anthony Levatino. I'm a practicing obstetrician gynecologist, and I've performed over 1,200 abortions. Today I'm going to describe a first trimester surgical abortion called suction D&C, dilatation and curettage. This is the most frequently performed abortion and is used typically from 5 to 13 weeks of pregnancy. After administering anesthesia, the abortionist uses a speculum like this. This is placed inside the vagina and opened using this screw on the side, allowing the abortionist to see the cervix, the entrance to the uterus. The cervix acts as a gate that stays closed for the duration of pregnancy, protecting the baby until it is ready for birth. The abortionist uses a series of metal rods called dilators, like these, which increase in thickness, and inserts them into the cervix to dilate it, gaining access to the inside of the uterus where the baby resides. The baby has a heartbeat, fingers, toes, arms, and legs, but its bones are still weak and fragile. The abortionist takes a suction catheter like this one. This is a 14 French suction catheter. It's clear plastic, about 9 inches long, and it has a hole through the center. It is inserted through the cervix into the uterus. The suction machine is then turned on with a force 10 to 20 times more powerful than your household vacuum cleaner. The baby is rapidly torn apart by the force of the suction and squeezed through this tubing down into the suction machine, followed by the placenta. Though the uterus is mostly emptied at this point, one of the risks of a suction D&C is incomplete abortion. Essentially, pieces of the baby or placenta left behind. This can lead to infection or bleeding. In an attempt to prevent this, the abortionist uses a curette to scrape a lining of the uterus. The curette is basically a long-handled curved blade. Once the uterus is empty, the speculum is removed and the abortion is complete. The risks of suction D&C include perforation or laceration of the uterus or cervix, potentially damaging intestine, bladder, and nearby blood vessels, hemorrhage, infection, and in rare instances, even death. Future pregnancies are also at a greater risk for loss or premature delivery due to abortion-related trauma and injury to the cervix. As I mentioned at the beginning, I'm Dr. Anthony Levatino.
So this is the baby that was taken out. Yes, this is the baby that you took out. You see the face, you see the arm, and then you just suck the baby out just like that. Now let's look at the other things that come with the adult class. And like I said, the adult class is only, you get such education only on GNTV, and I'm not sure any station has shown you any of these things. It's on Wednesdays at 10 p.m. to 11:30. That is where you get real education for adults. Real education for adults. You don't pay fees for that anyway. As students, you have to start paying fees for me to buy a new car. Today my car got spoiled and really messed me up, but no problem. Let's get back to it. Now there is another method that happens. Now look at this baby here, and then what happens is they use salt, concentrated salt, and look at what happens when they use the salt. Now they would put the salt inside the the mother's womb through the abdomen, and then put some into the baby's mouth. The baby swallows it, and then the salt just tears the baby into pieces, and then they suck it out. The salt poisons the baby, and then they suck it out. There are times when you have a stubborn child in there, and then you give it the salt poison, the baby doesn't die. You suck it out and you see the baby is still living, and then they kill it after that. So there are cases where the baby is still living and they suck it out and throw it out. So just look at this. This is the baby you're talking about. This is the baby that, you're just using salt solutions to just destroy. Now, this happens usually around the 8th week. And then by that time, the baby is about 5 inches long, about the length of a very big phone, 5 inches long. And then everything the baby can hold, it can grab, the hair is growing, the baby has his head on, and then by the 20th week, the baby is able to recognize the mother's voice. It has, through some small, the baby is growing rapidly. It's possible for you to, I am touched. Fingernails, fingerprints appear. Sex organs are detected around this time. And usually you use the ultrasound for the doctor to actually tell the type, whether it's a male or a female, around this age. Now see what happens. We have something we call the dilator and evacuator. That is evacuation, the dilation and evacuation, which is D and E. And this is what happens when the baby is around 13 weeks to 24 weeks. And I tell you, this baby here, I'm showing you, it's amazing what people do to the babies that they are carrying themselves. Now this is a picture of the baby being forced out and the doctor crushing the skull to be able to take the baby out. And I'll show you a video that shows exactly how these things are done, and then when you see it, you ask yourself whether what you are doing is right or wrong. So I am just touched by this, very emotional this evening, and it's not allowing me to do my real thing, but watch this video.
My name is Dr. Anthony Levatino. I'm a practicing obstetrician-gynecologist, and I've performed over 1,200 abortions. Today I'm going to describe a second trimester surgical abortion called dilatation and evacuation, or D&E. A D&E is performed between 13 and 24 weeks of pregnancy. After administering anesthesia, the abortionist uses a weighted speculum, like this one, that opens the vagina widely. Because second trimester babies are so large, this greater access facilitates a late-term abortion. Late-term abortion requires that the cervix be prepared 24 to 48 hours in advance with laminaria. Laminaria is a type of sterilized seaweed that absorbs water over 8 to 12 hours and swells to several times its original diameter. Once removed, metal dilators can be used to further open the cervix as needed. Once the cervix has been stretched open, the suction tube is placed inside. A baby at 20 weeks gestation is as big as the length of my hand, from head to rump, not counting the legs. The suction machine is turned on, and pale yellow amniotic fluid surrounding the baby is suctioned out through the catheters. With babies this big, they don't fit through catheters this size. The baby's bones and skull are too strong to be torn apart by suction alone. This is a Sofer clamp. A Sofer clamp is made of stainless steel. It's about 13 inches long. The business end is about 2.5 inches long and 1/2 inch wide, and there are rows of sharp teeth. This is a grasping instrument. When it gets a hold of something, it does not let go. The abortionist uses this clamp to grasp an arm or leg. Once he has a firm grip, the abortionist pulls hard in order to tear the limb from the baby's body. One by one, the rest of the limbs are removed, along with the intestines, the spine, and the heart and lungs. Usually the most difficult part of the procedure is extracting the baby's head, which is about the size of a large plum at 20 weeks. The head is grasped and crushed. The abortionist knows he has crushed the skull when a white substance comes out of the cervix. This was the baby's brains. The abortionist then removes skull pieces. He removes the placenta and any leftover parts of the baby with a curette, scraping the lining of the uterus for any remaining tissue. The abortionist then collects the baby parts and reassembles them to make sure that there are 2 arms, 2 legs, and all the pieces. Once all the parts have been accounted for, the abortion is complete. For the woman, this procedure carries a significant risk of major complications, including perforation or laceration of the uterus or cervix, with possible damage to the bowel, bladder, and other maternal organs. Infection and hemorrhage can also occur, which can even lead to death. Future pregnancies are also at greater risk for loss or premature delivery due to abortion-related trauma and injury to the cervix. As I mentioned at the beginning, I'm Dr. Anthony Levatino.
All right, so this is the baby that was just bashed, quashed, and taken out. All right, so your 6 months baby, unborn, covered, everything intact. It is living, and then people decide to just terminate it. Okay, so here, when it gets to this stage of 6 months and then the lady decides that the man says, I'm no longer interested in you, I'm not going to marry you, and wants to terminate it. Yes, there's a chemical abortion that is done. Now this chemical abortion, I will show you a video of how that chemical abortion is done. And let me just get it done. Great, watch this one too.
My name is Dr. Anthony Levatino. I'm a practicing obstetrician gynecologist, and I've performed over 1,200 abortions. Today I'm going to describe a third trimester induced abortion, which is performed at 25 weeks to term. At this point, the baby is almost fully developed and viable, meaning he or she could survive outside the womb if the mother were to go into labor prematurely. Because the baby is so large and developed, this procedure takes 3 or 4 days to complete. On day 1, the abortionist uses a large needle to inject a drug called digoxin. Digoxin is generally used to treat heart problems, but a high enough dosage of digoxin will cause fatal cardiac arrest. The abortionist inserts the needle with the digoxin through the woman's abdomen or through her vagina and into the baby, targeting either the head, torso, or heart. The baby will feel it. Babies at this stage feel pain. When the needle pierces the baby's body and the digoxin takes effect, the life of the baby will end. The abortionist then inserts multiple sticks of seaweed called laminaria into the woman's cervix. They will slowly open up the cervix for delivery of a stillborn baby. While the woman waits for the laminaria to dilate her cervix, she carries her dead baby inside of her for 2 to 3 days. On day 2, the abortionist replaces the laminaria and may perform a second ultrasound to ensure the baby is dead. If the child is still alive, he administers another lethal dose of digoxin. The woman then goes back to where she is staying while her cervix continues to dilate. If she goes into labor and is unable to make it to the clinic in time, she will give birth at home or in a hotel. In this case, she may be advised to deliver her baby into a bathroom toilet. The abortionist then comes to remove the baby and clean up. If she can make it to the clinic, she will do so during her severest contractions and deliver her dead son or daughter. If the baby does not come out whole, then the procedure becomes a D&E, a dilation and evacuation, and the abortionist uses clamps and forceps to dismember the baby, piece by piece. Once the placenta and all the body parts have been removed, the abortion is complete. Late-term abortions have a high risk of hemorrhage, lacerations, and uterine perforations, as well as a risk of maternal death. Future pregnancies are also at a greater risk for loss or premature delivery due to abortion-related trauma and injury to the cervix. As I mentioned at the beginning, I'm Dr. Anthony Levatino.
All right, so I think I've had enough of this for today. So I will stop here. Yes, at least you've seen enough. We are at the 30th week, and then we have just about 8 more weeks or 10 more weeks to go from the time you had you got pregnant to the time you deliver, and the things you do to it. So I will pause here. Next week, God willing, when we come, we're going to show you what people do from the 30th week all the way to the time when it's about time when the baby is completely ready for birth, the sort of stuff that people do. And then we will look at the effects on the woman physically, mentally, and psychologically. And then we also look at the effects on the woman in her attempts to have subsequent children, the general life, let me say the general side effects of getting yourself involved into some of these things. But I'm sure with what you have seen, you have learned something new today. And as usual, what we do in Mr. Smooth's class is all learning. Nothing filthy, nothing dirty. It's all adult, serious education. And I'm sure these videos you have seen and the explanations I've given to you would inform you to make a decision when you're pregnant. A wise one when you're pregnant. And like I keep saying, it is best to abstain when you are not married. I'll end Mr. Smooth's class to bringing this show to you all the time. Alright, my name is Papa Kwam Namu. You can call me Mr. Smooth, and my contact is right there on the screen. I say goodbye to you.